Welcome to NSG4070 Legal and Ethics. I'm Professor Heather Murphy, and this series will take you through key points we go over in class, as well as provide you some tips and tricks to prepare you for the NCLEX. I am joined today by three of my podcast colleagues who will share their expertise in this area.
Hello, everyone. I am Caitlin Hope, and I have been a registered nurse for only 2 years, so I can relate to you as future new RNs. We may not think that ethics and legal issues arise often, but you would be surprised. That is why we are here today to share some knowledge and examples, so when you encounter them in practice, you'll be prepared to navigate those scenarios.
You're right, Caitlin. I'm Karen Whitaker, and I'm also a registered nurse. I can tell you that morals are about personal ideas of right and wrong, what you were raised to believe is good or bad. Moral philosophy is that deeper discussion of what's good or bad, right or wrong. Ethics zooms out to the group level. It's the study of social morality and reflection on society's norms and practices. In nursing, ethics is, what should we do as professionals given our codes and standards?
Hello, class. I'm Derek Mendoza, and I've been an RN for many years and also teach nursing. On the floor, you might feel a moral pull, like, I'd never refuse this treatment for my family, but ethically, you still have to respect a patient's decision to refuse it.
Exactly, and nurses are constantly making ethical decisions, delegating to assistive personnel, disciplining an unsafe peer, speaking up about how resources are distributed on the unit. It's not just at end of life, it's all day, every shift.
And on the NCLEX, those which action is best questions often hide an ethics question. If you can spot the principle, the answer gets a lot clearer.
Let's hit the big ethical theories you'll see underneath those questions. First up, utilitarianism. That's the greatest good for the greatest number idea. An action is judged by its end result. Does it increase overall happiness or benefit?
In nursing, think triage during a mass casualty. As difficult as it may be to pass by the dying patient to save those who have a chance to survive may be, that is an example of utilitarianism. It is doing the greatest good for the greatest number.
Next is deontology, which is duty-based. The rightness or wrongness of an act depends on the nature of the act itself, not the outcome. You do something because it's your duty, period.
So, it's my duty to advocate for a kid who needs blood to survive, even if the parents refuse. Deontologically, saving that life and honoring my professional duty to the child takes center stage, even though the situation is emotionally messy.
Most professional codes of ethics borrow heavily from that duty-based thinking. Then we've got virtue ethics. Instead of rules or outcomes, this one focuses on character traits, compassion, discernment, trustworthiness, integrity. NCLEX tip here. If the question talks about outcomes for a group or allocation of resources, you're probably in utilitarian territory. If it emphasizes duty, rules, or professional obligations, think deontology. If it highlights traits like compassion or integrity, that's virtue ethics.
Let's bring this down to the bedside and walk through the core ethical principles you'll see over and over: autonomy, beneficence, nonmaleficence, justice, veracity, fidelity, and confidentiality. Do you remember learning those in your intro class many semesters ago? We also touched on these during our mental health lab, and now they're back.
I'll grab autonomy. Autonomy is about self-governing, the right to self-determination. An autonomous person can set personal goals, decide on a plan, and act on that choice. Our job is to respect that.
And autonomy gets threatened because patients are in a dependent role, and we're in a power role. That imbalance can lead to us sliding into I know best mode without meaning to.
A classic NCLEX-style autonomy scenario. Competent patient refuses a treatment, like a blood transfusion or surgery. The correct action is usually to respect the refusal, clarify understanding, notify the provider, not to pressure, threaten, or sneak in the treatment anyway.
Related issues are informed consent, paternalism, advocacy, noncompliance, self-determination. If the stem mentions teaching before consent, clarifying understanding, or honoring refusal, your autonomy radar should go off.
Okay, beneficence, to do good. We act in ways that benefit patients, promote good, prevent harm, remove harm. Think of choosing to spend more time with a high acuity patient. You're not ignoring the others, you're balancing your time to do the most good where it's needed most.
Non-maleficence is the flip side. Avoid causing harm, even while you're trying to do good. Weigh the risk of harm against expected benefits. A needle stick for an immunization. That's short-term pain for long-term benefit. Opioids for terminal pain. Relief, but risk of dependence or hastened death. Keeping a patient NPO longer than they'd like to protect them for a procedure.
Even reporting a colleague for unsafe practice is non-maleficence. It might hurt feelings or relationships, but it protects patients from harm. Same with seeking legal input for life-saving treatments.
Justice is about fair, equitable, appropriate treatment in light of what's due to each person. Distributive justice asks how we divide limited goods, beds, staff, medications. You'll see rules like to each according to need or to each equally.
On an exam, if the STEM is about who gets a resource first, like the homeless patient or the VIP patient who is CEO of a company, you're looking at justice. Practicing justice would involve weighing which has higher acuity, not which is the person who can afford it best.
Veracity is telling the truth. It builds respect, open communication, trust, and shared responsibility. Codes of nursing ethics promote veracity and treat it as a universal virtue.
And you might see tension between nursing and medical perspectives. Some physicians might avoid disclosure for the patient's good, like not telling a mother in the ED that her children died, or not reminding a woman with dementia that her father is gone. As nurses, we still value honesty, but we also balance it with compassion and the patient's condition.
Fidelity is faithfulness and promise-keeping, being trustworthy and competent. If you tell a patient, "I'll be back in 15 minutes with your pain med," fidelity means you actually follow through or explain the delay.
And confidentiality. Don't disclose private, sensitive, or secret information. Privacy is the patient's right to control their personal information. Respecting confidentiality supports autonomy and encourages people to seek care.
But it's not absolute. There are limits when we have a duty to protect others from harm. Foreseeability is key. You reasonably foresee harm, and that triggers duty to warn or mandated reporting, like for children, disabled adults, or seniors.
On NSG4070 or NCLEX-style items, if you see social media, technology, HIPAA, or sharing information with coworkers, think confidentiality. The safest answer usually keeps information on a strict need-to-know basis and avoids posting or casual sharing.
NCLEX tip. Match key words in the STEM to principles. Patient chooses, refuses, decides. Autonomy. Do good, promote comfort. Beneficence. Prevent harm, report unsafe, weigh risks. Nonmaleficence. Fair, equal, who first. Justice. Truth, honesty, informing. Veracity. Keep promises, follow through. Fidelity. Privacy, HIPAA, social media. Confidentiality. Then eliminate distractors that violate that primary principle.
Let's practice with a few quick vignettes and layer in some test strategy.
Okay, end of life first. Your terminally ill patient with severe pain says, "I don't care if this medicine shortens my life. I just don't want to hurt like this." The provider orders opioids that might hasten death a bit, but will relieve pain. What's the main ethical principle in your nursing actions?
I'd say we have both beneficence, relieving suffering, and non-maleficence, carefully weighing the risk of hastened death. On the test, if you have to pick one, look at the wording. If the options emphasize preventing or minimizing harm while treating pain, that's non-maleficence. If they emphasize promoting comfort and good, that leans beneficence.
And autonomy is in there too. The patient is clearly stating their goal. so a strong answer respects their informed choice while safely managing the medication.
Next vignette. You observe a colleague repeatedly giving meds late and skipping independent double checks on high alert drugs. What principle drives your response?
Non-maleficence again. Avoid causing harm. Reporting unsafe practice to protect patients is ethically justified, even if it feels uncomfortable. Fidelity shows up too because we've promised to safeguard patients.
On an exam, the best answer usually involves following policy and escalating through the chain of command, not confronting in a hallway argument or ignoring it. Watch for words like report, document, follow institutional policy.
Third vignette, social media. A nurse posts a selfie at the nurse's station with a patient in the background, even if the name isn't visible. What's the primary issue?
Confidentiality and privacy. Technology and social media are specifically mentioned as contemporary confidentiality issues. Even without a name, you're sharing identifiable health information.
The safest NCLEX-style response would be something like, report the breach according to policy, reinforce education about social media and HIPAA, and avoid posting any patient-related content yourself.
Now, quick refusal of treatment twist. A competent adult refuses a life-saving procedure. Family begs you to convince them. What's your priority principle?
Respect for autonomy. You clarify understanding, make sure there's no confusion or coercion, and then honor the patient's decision, even when it clashes with what the family or staff wants.
Let's bring in ethics committees for a minute. When you've got conflicting principles like autonomy versus beneficence, or every option feels right somehow, ethics committees can help.
Their primary functions are consultation, education, and policy. They facilitate ethical analysis and support decision-making when the team's stuck.
Nurses play a key role there. We balance advocacy for the patient with cultural sensitivity and clinical guidelines. At the bedside, that might mean saying, I think we need an ethics consult when goals of care are unclear or the family is divided.
Okay, let's wrap with a few NCLEX strategy nuggets for ethical questions. Derek, you start.
First, use safety first. If you're torn, pick the option that best prevents immediate harm. Non-maleficence usually wins as a tiebreaker.
Second, think least restrictive, least invasive. If several answers respect the same principle, choose the action that protects rights and autonomy with the least restriction, like teaching and clarifying before restraining or forcing treatment.
Third, keep respect for autonomy in mind. If a competent patient's clear choice is on the table, the correct answer usually honors that choice while ensuring they're informed.
And keep matching language. Choice, goals, consent, autonomy. Comfort, benefit, beneficence. Prevent harm, report unsafe, non-maleficence. Fair distribution, justice. Tell the truth, veracity. Keep promises, fidelity. Protect information, confidentiality.
If you can name the principle, you can usually spot the best answer. And be that nurse at the bedside who calmly says, here's what's ethically sound.
This stuff really does get easier the more cases you see. You start recognizing patterns instead of memorizing rules.
All right, we're going to land the plane there. Ethics isn't about being perfect. It's about thinking carefully and consistently doing right by your patients and your profession.
Thanks for hanging out with us today. I'm Professor Murphy, and I love seeing students grow in this area. It really shapes your whole career. Thank you, Caitlin, Derek, and Karen for joining me today.
This stuff really does get easier the more cases you see. You start recognizing patterns instead of memorizing rules.
All right, we're going to land the plane there. Ethics isn't about being perfect. It's about thinking carefully and consistently doing right by your patients and your profession.
Thanks for hanging out with us today. I'm Professor Murphy, and I love seeing students grow in this area. It really shapes your whole career. Thank you, Caitlin, Derek, and Karen for joining me today.
If you can name the principle, you can usually spot the best answer. And be that nurse at the bedside who calmly says, here's what's ethically sound.
This stuff really does get easier the more cases you see. You start recognizing patterns instead of memorizing rules.
All right, we're going to land the plane there. Ethics isn't about being perfect. It's about thinking carefully and consistently doing right by your patients and your profession.
Thanks for hanging out with us today. I'm Heather, and I love seeing students grow in this area. It really shapes your whole career.
I'm Caitlin, and I hope you'll take these principles back to your next shift or your next practice question, and just try spotting them in real time.
And I'm Derek. Thanks for listening, y'all.
This is Karen, signing off for now. We'll be back with more episodes to keep building your confidence. Take care, and we'll see you next time.